Lupus nephritis is an renal disease. Look at this picture, shows that kidney and damaging the kidney tissue, and CT findings, detail going on. Introduction. Lupus nephritis is an inflammation of the kidneys caused by systemic lupus erythematosus, an autoimmune disease. It is one of the most serious complications of SLE and can lead to end-stage renal disease if not properly managed. Definition. Lupus nephritis occurs when the body's immune system mistakenly attacks the kidneys, causing inflammation and damage to the kidney's tissue. This can impair the kidney's ability to filter waste from the blood effectively. Types. Lupus nephritis is classified into 6 classes based on the World Health Organization and International Society of Nephrology or Renal Pathology Society. Classification systems. Class 1. Minimal mesangial lupus nephritis. Class 2. Mesangial proliferative lupus nephritis. Class 3. Focal lupus nephritis. Class 4. Diffuse lupus nephritis. Class 5. Membranous lupus nephritis. Class 6. Advanced sclerosis lupus nephritis. Causes. Exact cause of lupus nephritis is unknown, but it is believed to be related to a combination of genetic, environmental, and hormonal factors. These factors trigger the immune system to attack the kidneys, leading to inflammation and damage. The causes including 1. Genetic factors, genetic predisposition, family history, to immune system dysregulation, autoantibody production, immunocomplex formation. 3. Epigenetic modification, epigenetic changes. 4. Immune cell abnormalities, T and B cell dysfunction, complement system activation. 5. Environmental factors, infections, UV light, medications. 6. Hormonal factors, sex hormones including testosterone, estrogen. Risk factors. 1. Gender. Women are more commonly to develop lupus nephritis. 2. Age. It commonly affects individuals between the ages of 15 and 44. 3. Ethnicity. Higher prevalence in African American, Hispanics and Asians. 4. Genetics. Family history of SLE or other autoimmune diseases. Complications. Chronic kidney disease, end-stage renal disease. 3. Hypertension. 4. Infection due to immunosuppressive therapy. 5. Cardiovascular diseases. 6. Thrombosis. Pathophysiology. In lupus nephritis, immunocomplexes antigen antibody complexes deposits in the kidneys, leading to inflammation and damage to the glomeruli, tubules, and intestinal tissues. This immunoresponse can result in proteinuria, hematuria, and decreased kidney function. Pathophysiology of lupus nephritis in steps: 1. Autoantibody production. 2. Immunocomplex formation. 3. Immunocomplex deposition. 4. Activation of complement system. 5. Inflammatory response. 6. Glomerular injury. 7. Tubulointestinal involvement. 8. Chronic inflammation and fibrosis. 9. Functional impairment. 10. Clinical manifestations. Signs and symptoms: 1. Edema, swelling in the legs, feet and ankle. 2. Foamy urine indicating proteinuria. 3. Hematuria, blood in the urine. 4. Hypertension, high blood pressure. 5. Weight gain due to fluid retention. 6. Fatigue. Diagnosis: 1. Urine analysis to detect proteinuria and hematuria. 2. Blood test to assess kidney functions, creatinine, and autoantibodies, ANA and dsDNA. 3. Renal biopsy to determine the class of lupus nephritis and guide treatment. 4. Imaging test: ultrasound or CT scan to evaluate kidney size and structure. Nursing diagnosis: 1. Impaired urinary elimination related to kidney inflammation. 2. Fluid volume excess related to impaired kidney function. 3. Risk for infection related to immunosuppressive therapy. 4. Fatigue related to chronic disease and anemia. Management: 1. Monitoring, regular assessment of kidney function, blood pressure and urine output. 2. Education, teaching patients about medication adherence, diet, lifestyle modifications. 3. Support, providing emotional support and resources for coping with chronic illness. Treatment: 1. Medications, corticosteroids to reduce inflammation, immunosuppressive drugs such as cyclophosphamide, mycophenolate, mofetil, and acetoferin. Then ACE inhibitors or ARBs to control blood pressure and reduce proteinuria. Two, dialysis for patient with severe kidney damage. 3. Kidney transplant in case of ESRD. Psychosocial medicine: 1. Psychological support, counseling, and support groups to help patients with cope with the emotional burden of chronic illness. 2. Social support, assistance with financial, occupational, and social challenges. 3. Education, informing patients and families about the disease, treatment options, and lifestyle adjustments. Prevention: 1. Regular checkup, early detection and management of SLE to prevent kidney involvement, to healthy lifestyle, balanced diet, regular exercise and avoiding smoking and alcohol. 3. Medication adherence, following prescribed treatment plans to control lupus activity and prevent flares. In conclusion, lupus nephritis is a serious and potentially life-threatening complication of SLE. Early diagnosis and aggressive treatment and ongoing management are essential to prevent kidney damage and improve patient outcomes. Thank you. Have a nice day.